welcome to the show. The topic today is public health in Nashville, and we've got a special guest with us this morning. She is Dr. FWadley, who is the Director of Health for the metropolitan Davidson County area. And Dr. Wadley, let me welcome you to the show this morning.
Thank you. It's a treat to be here.
Dr. Wadley, the topic is public health in Nashville this morning, and what we'd like to do is to cover a wide range of issues that the public might be concerned with at this particular time. And of course, we recognize that there are many areas that we could zero in on, but especially we'd like to talk about venereal diseases, because I think that is one of the major problems that has appeared in our newspapers lately, especially the number of case increases and that kind of information. And so if you could start us off by giving us some information relative to venereal diseases.
Well, one of the things we've been talking about, and you've probably read in the papers, about our increasing syphilis. And across the nation, it's the highest rate that it's been in 40 years. After we found penicillin, we thought that the problem would be over. And in Nashville, we have seen this climb over about the past 4 years. But this year, we've seen a dramatic increase. And as we look toward Memphis, we've seen what their rates have done in the past 2 or 3 years, and they now have the honor of being the third highest in the nation. So we're concerned in Nashville because we'd like to see if we could get a control on the epidemic before we get to Memphis rates. We have already had reported this year, as of October the 15th, 361 cases. That's bad enough in itself because it's about 3 times what we had last year. But the past 2 weeks, or the first 2 weeks in October, we had 33 cases. If we continued at that rate, we'd have about 750, 800 cases a year. So the disease that we thought was gone is very much back again. And I guess one of the biggest concerns is that we've also had 3 cases of congenital syphilis, which means that the mother had it and then the baby was born with those problems. And so we're looking very carefully at what we can do in the way of syphilis. Now, I guess one of our biggest problems has been, at least initially with the outbreak, it was in our drug-using population. I can say now, though, that people should not sit back and say, well, that's no risk for me, because we're already beginning to see, as the rates increase, that it's getting out of the drug-using population. Past few weeks we've seen in college students and in high school students.
Now, what about college students and high school students? I think that that's the prime age for the spreading of the disease. What are we doing in that area?
Well, we're trying very much to make them aware that all sexually transmitted disease are a problem, and that they should be aware of that, should be aware of the precautions, should be aware of the symptoms, so that when they first notice the symptoms, they can either go into their physician or to the health department for diagnosis and treatment.
Now, this is also sort of an entry-level disease for HIV infections, is it not?
One of the things that we're concerned about is that they have already demonstrated that if you have syphilis and you also are exposed to HIV or the AIDS virus, that increases your risk for getting AIDS. And so, yes, we're very concerned, especially since we have syphilis in our drug-using population, and that's a population that you're concerned about HIV or AIDS, then yes, that could accelerate the transmission of the HIV virus in the same population.
Now, what about AIDS? I mean, what about that as a problem facing you as a director of health in the metro system?
Well, if you looked at just the cases that reported since 1982 for Nashville, Davidson County, the last report that the state was in end of August, 306 cases of AIDS. That's bad enough, but I think most people don't recognize that those are just the cases of people that are sick. There are many more people that are infected with AIDS at this time. In fact, it's estimated to be around 1,500 probably in Davidson County. Those individuals in the future will be getting sick. Now, the average time from infection to the time your immune system starts wearing down may be 10 years. So we know by seeing the ones that are coming in and are testing positive that we're going to have a tremendous problem over the next few years trying to provide health care for the ones that are already infected.
Now, even up to today, how has this impacted upon your budget? I mean, the financial
Tremendously,
aspect
in that we get some money from the federal government to do some testing and some counseling. We immediately recognized that there were a lot of individuals that would test positive for AIDS. They did not have the money to go to a private physician. They did not know what their status was, how sick they were. So we tried to set up a clinic in January of '88. For those people who test positive, they can get a physical exam, some lab work, and we can tell them, your immune system is okay now, check back with us in 3 months, 6 months. We call that our HIV Plus clinic. From 1988 until now, there has been such an increase in the number of individuals testing positive, enrolling in that clinic, and then becoming sick in that clinic, that now we may have 10 to 15 patient visits a day, many calls on the telephone. There has not been any additional money to take care of these patients, so we've had to be just sort of pull from everything and operate on a shoestring budget in order to provide care for these individuals.
I mean, that's a very depressing story, and it seems that all indications are that AIDS will be worse rather than get
One
better.
of the best studies, I think the most reliable studies, was done by the Tennessee Department of Health and Environment. They tested all newborn babies. This was what they call a blind study, in that you have to send in a blood sample on all babies born for a couple of diseases. When they got through doing those tests, they tore the name off the test, and on every baby born in Tennessee between May and September of 1990, they did a test. Now, the test won't tell you how many babies are going to have AIDS, because it's an antibody test. It will tell you how many women were positive for the virus. And of those women, then maybe 30% of their babies will go on to have AIDS. But this is one of the best tests across the board that was done. When they got through, they named Nashville the epicenter for AIDS in Tennessee, because out of all women delivering during that 6 months in Nashville, 1 out of 200 Afro-American women were positive for AIDS that delivered. 1 out of 1,000 white women were positive, but both of those had a rate twice as high as any place else in Tennessee. So we know from that study, which is probably the best one we have a tremendous problem with HIV in Davidson County.
Now, what are we going to do in terms of meeting this need? I know as the Director of Public Health that you've had all kinds of meetings dealing with financing the fight against AIDS and other diseases, but what are we going to do in order
We've actually written several grants trying to either get private funding, federal funding, and unfortunately we're seeing budget reductions federal, state, and local level. And we're seeing what few dollars are available for care, they want to put them in cities where the caseload is astronomical, like New York City, Florida, that type of thing. What we've had to do to just sort of meet the need in that clinic, plus meet the need for syphilis, is take positions from other areas of the department to prioritize where we have to put our efforts. And we're sort of holding things down now, but what we're worried about is that can only go on so long. What do we do a year from now, 2 years from now, when a lot of the people are becoming symptomatic of AIDS?
As a matter of fact, you've indicated that you would